As we continue our coverage of the COVID-19 pandemic, local pharmacy operators have written to the competent authority to adjust the parameters of their operation, declaring that the restricted hours have been difficult for them as well as their clients. The Bahamas Pharmaceutical Association told our Keishla Adderley that without the changes, it will be difficult to meet the needs of the sick.
It's a common sight these days, long queues everywhere. But for those seeking medical intervention, it's more than a hassle. It could be a health emergency.
The Pharmaceutical Association has raised issues regarding the services its members provide.
That acknowledgement from the Prime Minister after the Bahamas Pharmaceutical Association, BPA, wrote a letter explaining the quandary that emergency orders have placed members in. President Shantia McBride.
Okay. The Pharmaceutical Association requested an amendment or an exemption to the emergency order as it pertains to the pharmacy operation hours. We requested Monday to Friday, 7 a.m. to 5 p.m. and on Saturday, 7 a.m. to 4 p.m. for essential workers. We felt that this was necessary to allow accessibility to the public.
And excessive calls into pharmacies during the hours they've been ordered closed have proven the point and raised fears over missed dosages.
We have had a lot of persons or patients calling in, indicating that during the lockdown, during the alternate days, they were in need of medical assistance or medical medication, primarily over-the-counter needs. And by pharmacies being closed, the accessibility was limited. We're requesting that we at least have the additional hours to service the same volume of persons that we would usually do in our regular week.
In addition to that, the 50% cut in hours of operation makes it difficult to schedule staff, especially when coupled with social distancing protocols. Meantime, the association has also noted a trend with medication purchases, a symptom of COVID-19 and perhaps the hard economic times.
Persons that may have purchased a month's supply of their medication, they would now reduce a month's supply to 2 weeks supply or maybe 1 week at a time. So therefore, if they reduce it, they would have enough monetary funds to now have accessibility to go to food store or to Arcane shop, or based on when there's a new public service announcement by the competent authorities, then we may see that influx of new prescriptions.
The association is awaiting a response from the competent authority on its concerns as it awaits a remedy, along with the rest of the country, to the complications of COVID-19. Keishla Adderley, ZNS Network News.